Good evening, everyone. I'd like to welcome all those of you listening and viewing, both here and abroad. Thank you for joining us for this COVID-19 update. With us this evening, we welcome the Permanent Secretary within the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-Wyke, as well as our National Epidemiologist, Dr. Shalodin Ahmed. We begin this evening with our Permanent Secretary, Mrs. Wyke. We ask that you stay with us, not focus just on the numbers this evening, but listen to someone who has worked in the background for over a year at the command post, guiding along with our Honorable Minister of Health, Mrs. Wyke.
Good evening to the listening public. Let me first express my deepest thanks and appreciation to all of you for the continued support that you have been giving to the Ministry of Health and by extension, the government of Dominica during this COVID-19 pandemic. The ministry has been doing its best in keeping you updated with what is happening as it relates to the COVID-19 situation in Dominica. As a country, we are doing our best in spite of the challenges. We have seen positive outcomes, and this propels us to continue the battle against COVID-19. As we are all aware, dealing with COVID-19 has not been easy, and based on the trends both regionally and globally, we know that we still have a lot to do in this regard. On our previous briefings, we have provided updates on the number of cases, our testing, adherence to protocols, importance of vaccination, among others. In so doing, human and physical resources are very critical in achieving good results. Over the past few weeks, several initiatives have been implemented. These include putting systems and structures in place, all in an effort to ensure the saving of lives and quick recovery of our COVID-19 patients. In terms of infrastructure to accommodate this extremely large number of admissions, existing facilities had to be expanded and new facilities had to be established, with our goal being all who require a bed would have one made available to them. Currently, there are 9 facilities being used, and these facilities have all been approved by Cabinet. Cabinet has also approved naming of our facilities as the COVID-19 Care Complex. The facilities are assigned on based on the conditions of the patients, whether they are symptomatic or asymptomatic, as well as those who will require very close monitoring. Upon arrival at the main facilities, our patients are assessed and referred to the appropriate facility. With all the physical structure in place, human resource has also been a major focus. These include medical, nursing, and support staff. Positions were created to include a medical director for the COVID-19 Care Complex, and he received support from consultant specialists, medical officers, as well as medical interns. To further augment our provision of services at the COVID-19 Care Complex, a review of the nursing structure was done to include the appointment of a deputy PNO for administrative services and a deputy PNO for clinical services, and the PNO is the principal nursing officer. Additionally, focus has been placed on the management and monitoring of home isolation. In that regard, a national coordinator has been assigned to ensure that health teams work efficiently to monitor those within their districts. Upon transfer to home isolation, a telephone number will be provided to the public for each district to facilitate calls from those who are in home isolation. We encourage you to use those numbers appropriately. The hotline remains open to receive other COVID-19 related concerns. For those of you required to isolate at home, a red wristband is provided. This means that you are to remain at home in isolation and follow the instructions given by the healthcare provider for home management. This red wristband should only be removed by a medical professional. We do not take for granted that having to isolate takes a toll on you and your family. We empathize with you, but as always, this is being done in your best interest and that of your loved ones. Although I was introduced as the permanent secretary, I am first and foremost a nurse, and therefore I can relate to the anxieties that you encounter. This is a natural feeling. This can be managed through prayer, keeping occupied, and communicating with the people you care about. Technology has made it easy to do so. Just as you, being unable to do this alone, the ministry cannot carry this burden alone. It involves a national effort. And so, I take this opportunity to thank all those who have willingly come on board. Our caterers, taxi drivers, our property owners, those involved in logistics, the media personnel, utility companies, the cleaning and sanitization teams, our business owners and all the private sector entities who have facilitated donor purchases and who have also made donations. The various ministries who have made health their priority. Our regional and international partners and friendly governments. The staff who provided tremendous support. You have left your families behind, your children, your husbands, your loved ones. You have sacrificed time, rest, vacation to support for duty. We cannot show our appreciation to you. We may give you financial support, but the commitment that you have demonstrated, we are not taking for granted, and we deeply appreciate that. As we continue this fight, I ask all of you to remain committed. We will provide you with the support that we can, and together we will overcome COVID-19. Thank you.
And our thanks to the Permanent Secretary in the Ministry of Health, Wellness and New Health Investment, Mrs. Letitia Lestrade-White. You too, yes, you've committed to this fight. We cannot thank you enough for your leadership. You as well have left your family at home. You've sacrificed your time and your energy. So we thank you for that commitment, that dedication. Ladies and gentlemen, we welcome this evening again our national epidemiologist, Dr. Shaludin Ahmed.
Good evening, everyone. It's my pleasure to present you COVID-19 status in Dominica. As of August 17, 2021, total active cases 738, and that includes 280 PCR positive cases and 458 rapid antigen positive cases. So far, to date, total recovered 411 cases. Total COVID-associated death, 1. Total number of people tested, 38,396. Total PCR tests completed, 23,227. And total rapid antigen test completed, 15,169. I want to take you to another stage of this presentation to give you our epi curve as it relates to COVID-19 cases in Dominica. So these confirmed COVID-19 cases include those who are PCR positive as well as those who are rapid antigen test positive. And data includes July 28 to all the way to August 17, 2021. Our initial cases were identified 28th of July, 2021. And subsequent to that, as you can see the graph on your screen, that it continues and it peaked August 10, and then there is another peak on August 16. There are two bar graphs, two colored bar graphs. One is blue, other one is orange. Sorry, it appears that I have to, if you can see, so this is my presentation on daily COVID-19 cases that identified or detected through PCR testing method as well as rapid antigen testing method. So our initial case were identified on July 28 and cases continued all through to August 17, 2021. There are two bar graphs. One represents PCR, that is in blue color, and the other one is rapid antigen, which represents the rapid antigen test. The color is orange color. And as you can see, the peak we have noticed somewhere in August 10, where the PCR peak on that day, and then there's a second peak through antigen testing that is in 16th of August. Now, as you notice that on August 12, the PCR or number of PCR positive cases went down way below. That was the reason behind actually we announced that on August 11th that all rapid antigen positive case will be considered as confirmed COVID cases. As a result, there were no further PCR testing or for those who are antigen positive, they were not tested with PCR testing method. As a result, the number of PCR testing went way low from August 12 and thereafter. I also want to add in this slide is that our age range from 7 months old to 92 years old, and median age is 28 years old. So with this presentation, with this graph, I want to say that the COVID-19 cases are not over yet. We continue to see the cases coming in. As you can see, we have two peaks here. So we need to observe our public health measures as much as possible. We need to continue our work in this fight against COVID. Okay, my second presentation is the distribution of the COVID cases all through the island. I'm not sure if you can see the graded color on this map of Dominica. The Roseau Health District, in this map, we have 7 health districts. From the north, we have Portsmouth, Marigot, Castle Bruce. Then we have Roseau, St. Joseph, and La Plaine, Granby and La Plaine at the bottom. of these 7 health districts, as you can see, Roseau is the brightest in terms of number of cases are coming from. 77% of the cases are coming from Roseau Health District. And as you know, the population of Roseau Health District represents 50% of the total population. And after, we have 6% cases are coming from Grand Bay Health District. Then we have Marigot Health District, 4%, Portsmouth, 5%, La Plaine, and La Plaine represents 3%, and Castle Bruce represents only 1% of the total number of positive COVID cases. Now, I want to also share with you some of the characteristics of these cases. The over 80% of the cases are asymptomatic. Over 75% cases are unvaccinated. And 90% of the symptomatic cases are unvaccinated. So this is to say vaccination works. In most cases, I have seen many families. A few examples I want to give that a family of 4, I have seen 2 positive cases who are unvaccinated and 2 negative cases who are vaccinated. I have seen other families where mother is vaccinated and negative, son is positive and son is unvaccinated. There are many examples like that. So I would like to say to the public that we still have time to get vaxxed, and we can stop this carnage of COVID-19 in Dominica. I want to assure you that this surge will go down. However, it will reappear. It will reappear if we don't get vaccinated soon enough. There will be many other variants to come. Delta is just one of them. There will be Lambda, there will be all the Greek letters that exist will be there. So if we don't get vaccinated as early as possible. So with this, I thank you for listening. Good evening.
Thank you so much to Dr. Ahmed. Again, 738 active cases here in Dominica, 280 PCR positive cases, 458 antigen positive cases. From Dr. Ahmed's presentation, obviously, we understand that COVID does not discriminate, not by age, not by social status, not by gender, not even your address can save you from COVID-19. This fight against this virus is a national fight. It's not the Ministry of Health's fight. It's not the government of Dominica's fight. It requires all hands on deck. So that means you have a role to play. And what is your role? Adhere to the protocols, the health and social and safety measures that we've been reiterating over and over again. Some of you might call us broken records, but that is what will save us. Ladies and gentlemen, we thank you as always for your attention. We continue to plead with you to do what you have to, not just to protect yourself, but your grandmother, your mother, your child. All of Dominica needs your effort to remain protected. Thank you to our media partners, as always, for bringing this broadcast, and thank you to all those of you who are paying attention, who listen earnestly every night. Have a good evening.